Honestly, it's hard to remember the failed because now I only remember, yay, we're pregnant.
We're the Edwards family.
Daddy, smile.
Okay.
We came here just for our consultation, and I think, just thought we'll have a couple visits, everything's going to be fine. That's what we kept telling ourselves. And then after doing some tests, we realized there were some problems, and we started out the process by doing IUIs. After 4 IUIs, we talked to Dr. Nichols and reevaluated the situation and decided, with his advice, to do in vitro fertilization. I was scared. I was scared about the cost. The financial aspect weighed heavily on me, and then also what I had always heard of, the amount of shots you have to take, and it goes on forever and all that. But from the minute that we had started here with Dr. Nichols, we had been very comfortable, and we never doubted their medical expertise. We never had any reason to not trust what he was saying. So we decided, you know, this is what we want. We want a baby. We dove into it, and yeah, it's not the easiest thing to go through. You do have your shots every day, and you have your visits and trips back and forth to the doctor, but it really wasn't this horrible scenario that I had played out in my head. They were kind. They were supportive. They weren't just another doctor's office that I was going to come into and leave. When we came in, they treated us like family and friends, and we actually developed a really good friendship, and we still have that friendship now. And they were honest with us. We knew when we came in, they would tell us what was going on and help us make the best decision that we could. We needed that personal interaction. This is a very personal experience that you're going through. You can be upset one day, happy one day, and you don't want to walk in somewhere and feel that you're just another number to them, another case number. And that was never the case here. When we walked in, they know you by name, they talk to you, they sit down, they interact with you, and it always makes you feel very welcome and comfortable. He told me, he's like, it didn't work. And the first time was very emotional. It was hard, but they were very supportive. When we came back for our next visit, they were like, this doesn't mean this isn't going to happen. We're just going to keep going. And just like family, they help push you to keep going. This was the most difficult experience of our lives. So with that in mind, you want to go somewhere where you can cry, you can laugh, and you can trust that 150% of their attention will always be focused on you. No matter how many other patients they have, you will always have their undivided attention. And they're going to treat you like they would their own family member. And that makes a huge difference for me with what we went through.